Placing a pillow under the knee can help correctly align the lower part of the spine, providing significant relaxation in the lumbar region and promoting a healthy spinal posture. Moreover, if the pillow is appropriate, it also contributes to the alignment of the cervical spine. However, it is important to consider that this position may not be suitable for everyone. For instance, people who snore, have hypertension, or are pregnant may not benefit from lying on their side, just as obese patients may feel discomfort in this position. Therefore, it is essential to consider these individual factors when choosing the best sleeping position. Obese patients often snore due to a number of reasons, with one of the main ones being the partial obstruction of the posterior pharynx, the area at the back of the throat. When we fall asleep, the muscles in this area relax and can fall back, obstructing the air passage. Many people breathe through their mouth, which intensifies this obstruction, creating air swirls that result in the characteristic sound of snoring. In more severe cases, snoring can be a symptom of obstructive sleep apnea syndrome, where patients experience episodes of stopping breathing for a few seconds while asleep. During these episodes, the buildup of carbon dioxide in the blood activates the respiratory center in the brain, leading the patient to resume breathing. However, these events can cause microarousals in the brain, resulting in the release of adrenaline to allow breathing again. This condition can lead to an increase in blood pressure and is especially concerning for patients with hypertension, as it can result in refractory hypertension, increasing the risk of severe cardiovascular complications. Therefore, if you are a patient who snores and is obese, sleeping on your back may not be the best position, as it may even worsen hypertension and increase the risk of death. If you are pregnant, it is also not the best position because the baby in the uterus weighs a lot, and when you sleep on your back, it presses on a vein called the inferior vena cava. That is why it is recommended to sleep on the left side. Sleeping on the left side is the position that many health professionals recommend, as it offers several significant benefits. For example, if you suffer from acid reflux, sleeping on the left side may be the best option. In this position, stomach fluids tend to fall toward the stomach wall, making it harder for them to return to the mouth. Additionally, sleeping on the left side can help empty the stomach more efficiently and improve bowel movements. For patients who snore, sleeping on both the right and left sides can help reduce the problem. This occurs because gravity tends to keep the throat wall more stable, which can decrease snoring. This position can also benefit blood circulation. For example, pregnant women and people with obesity or poor circulation in the legs are advised to sleep on the left side. This occurs because sleeping on the right side can put pressure on the inferior vena cava, which is responsible for carrying blood from the lower part of the body back to the heart. By sleeping on the left side, this pressure is reduced, allowing for more effective blood circulation. Improving blood circulation not only benefits the heart, allowing it to pump more efficiently, but it can also reduce swelling in the lower extremities and even in the face. In summary, sleeping on the left side can bring a range of simple and practical health benefits. When choosing a sleeping position, it is crucial to consider three important aspects. First, spinal health is fundamental. It is essential to ensure that the spine is well aligned in a neutral position. The best positions for the spine are lying on your back on the right side or on the left side. However, the ideal position is the one in which you feel most comfortable. Sometimes, placing a pillow over the knees or between them when sleeping on the side can help. Make sure the back is aligned, the lumbar region is not excessively supported, and the neck is not twisted or too straight, but in a comfortable position. Secondly, it is important to consider any health problems you may have. For example, if you suffer from reflux, sleeping on the right side can worsen the condition. If you have back problems, avoiding sleeping on your stomach is essential. For those who snore, it is advisable not to sleep on your back, especially if they are also obese and have obstructive sleep apnea syndrome unless they are receiving appropriate treatment. Each position can affect health conditions differently, so it is important to choose the most suitable for your case. Lastly, but not least, comfort is crucial. It is of no use to have less reflux or a well-aligned spine if you cannot sleep well or feel uncomfortable during the night. The best sleeping position is the one in which you feel comfortable and can sleep peacefully throughout the night. If this position also helps improve snoring and take care of back health, then you have found the ideal position, considering these 3 pillars. Now, let's address the second mistake I call obstacles to rest. Here are the drinks, foods, and common habits we practice every day. Let's start with the drinks. We often suggest that when you wake up, drink a glass of water with a few drops of lemon. However, we do not usually mention that you should avoid drinking water immediately before bed, as this can result in frequent interruptions to urinate during the night. It is advisable not to consume water approximately 2 hours before bedtime, as long as you have stayed well hydrated throughout the day, especially during physical activities. As bedtime approaches, it is important to avoid exposure to artificial light. Turn off screens and mobile phones and ensure that your room is completely dark, as this promotes an environment conducive to rest. This darkness will stimulate the release of melatonin, a hormone that helps regulate the sleep cycle and induce sleep. I will explain about melatonin and some options we can consider to improve the quality of our sleep. The circadian cycle is crucial and deserves our attention from the start. Practicing exercises first thing in the morning and taking a brief nap in the afternoon can help regulate nighttime sleep. Physical activity depletes the body and muscles, releasing substances that promote relaxation and physical and mental well-being a few hours later. This rest and activity routine should be an essential part of our lives. Regarding breathing, it is important to consider the role of the nose. It plays a crucial role in allowing air to flow without obstructions, preventing snoring. However, many people breathe with their mouths open, which can cause turbulence in the throat and increase the risk of snoring. Additionally, when breathing through the mouth, the air is not filtered or adequately warmed, which can impair sleep quality. Some people consider covering their mouths during sleep to promote nasal breathing. However, studies indicate that this may not solve the problem and may even worsen it, especially for those with nasal breathing problems. Therefore, it is essential to seek medical guidance before adopting any solution. If you want to learn more about health and longevity, subscribe to the channel and activate the notification bell so that you do not miss any new videos. Click on the video that is appearing for you and learn about the 5 foods that actor Chuck Norris consumes to stay healthy and energetic even at 84 years old. See you next time.